Hi, I'm Kelly Swoope from WMER2 News. Thanks for joining us for this special Facebook Live as we all deal with this global pandemic together. I'm joined now by Reverend Joe Hart from GBMC, and we're going to talk about the whole spiritual perspective of this. Reverend Hart is the Director of Spiritual Support at GBMC. Reverend Joe, thanks for joining us.
A delight to be with you today. Thank you so much.
First I want to start out with you. How are you and the hospital staff doing over there at GBMC? Because this is just so taxing on everyone.
Yeah, thank you. I think, are doing well. We are a team who is well prepared. We're professionals who anticipate chapters like this in patient care. And I think we as a team and as a hospital have really stepped up, to use a baseball analogy, stepped up to the plate to serve the community and the needs that we have, and more importantly, those of our patients and their families.
You are seeing patients and families at this point during some of their most difficult times. Talk with us a little bit about the perspective and insights that some of the patients and families maybe have shared with you during this journey.
Well, it's very interesting that those who are of religious faith certainly are drawing on that belief system more clearly and more directly. We are striving to help them connect and utilizing spiritual resources as much as possible. In fact, I have here some booklets that we have created for various faith groups, Catholic, Christian, Jewish, and that because there are a growing number of nones, those who are spiritual but not religious, we have a booklet just on reflections that are, if you will, poetry or spiritual thoughts for those folks as well. So we try to encompass all of the 34 different religious groups or denominations who self-identify within the hospital. But I think we are now in week 12 of this pandemic, that we are strong and we're moving ahead. I think we have great internal support from our leadership as well as from our fellow team leaders as we respond to the needs of our patients and families.
We have some folks out there who may have questions, and Rachel, I'm going to read to you. She has a question for you. She says, are chaplains available in the hospital to visit pre-op patients? It's very stressful right now going through surgery without the aid of your family or religious leaders there to support your visit. And I know that has to be tough.
Absolutely. I mean, we are available to meet those patients before surgery. We are there to pray with them, to support them, they and their families, whether it be the patient in person. We're now starting our surgeries up again, which we're very happy about as an organization insofar as serving the community. But we're also then able to bring virtually their family members to that bedside and pray or respond to the needs of the patient family before surgery. And they're welcome to contact our office here in Spiritual Support to make a referral, or electronically through our electronic medical system.
It's so interesting that you say that. I was watching a Diane Sawyer special last night on ABC News, and one of the segments was with the chaplain and the spiritual advisor of the hospitals at I think it was Mount Sinai, one of the major hospitals in New York, dealing with during the height of the pandemic. And because family members and friends couldn't be there with these people with COVID-19 in the worst of the worst times, his job was going from room to room with an iPad or some type of device like that to share with them family and friends who could not be there with him. And so in that regards, how important, how significant now is this virtual platform?
Well, iPads have really become our companions, if you will, on this journey. And I was saying to my team members earlier today that in these weeks, we've really been able to perfect the virtual connection that families are able to make with their loved ones. And while at first it felt really foreign, really foreign, but now it just feels like a companion that we just call in, and with the wonder and beauty of electronic media today, it's really very effortless. And I think the families are adjusting as well.
You think this is something that we will see kind of going into the future and beyond?
I absolutely do. Gallup tells us that 1 in 2 Americans live within 150 miles of their home of origin. So even in the best of times, many family members are not able to be with their loved ones during hospitalization. So I think this, even after the pandemic, will be a regular part of our connecting with patients and families.
So I guess some takeaways from this whole difficult time that we're all going through right now.
Absolutely, yeah.
Throughout everything that you guys have been through at the hospital, your personal journey, have there been any lighter moments in your journey with patients that you might want to share with people who are listening in or viewing?
Well, I think in all this, we have to have a sense of humor. So I have two small examples. One would be, I quote my great aunt, who has been dead many years, but she used to have this term that she would say, if somebody came to the door and knocked and she was in a house dress or whatever, she'd simply say, "Oh, you caught me in my unawares." So there are many people who come on virtually who are literally in their unawares that we respect, but behind the scenes, my internal voice is going, "Really?" The other would be a story, a very touching story of one of our patients who was dying, who her two grandsons, one was in Chicago, one was in Charlotte, and their grandmother, we had her on camera who was non-responsive, but the boys who were 17, hockey players, just kind of hanging out kind of guys, the one cousin says to the other, "You know, your mullet is really something, man. Like, that's really kind of wild." And so the other cousin talks to his grandmother saying, "Grandma, what do you think of my mullet? Is it doing all right or whatever?" And unfortunately, Grandma couldn't respond. But it was this wonderful interaction between a family and among family members that their grandmom was there and her opinion really mattered, even if she wasn't able to respond.
And maybe she wasn't able to respond, but you never know what she was listening to. You know what I mean? She could have been getting
She was totally listening to her grandsons, and that was pretty special.
What do you say to people to give them hope? I mean, there is a sense of hope now because we're seeing some openings and reopenings. But I got a teenager at home. Mom, when can I go hang out with my friends? 15. I miss my friends from school. And I can't imagine what it's like for parents of even younger children in terms of keeping them entertained.
Well, I think this is a time of great creativity, of looking at things that we wouldn't have thought of together. You know, when we think in terms of the togetherness, what do we tell our children is that, you know, it's that time to try to get away from electronics, even though they're very vital as we're talking about in our communication, but really spending time together. As I listen to families, I listen to my family and friends, it's a lot more time of just old time kinds of things like playing cards together, listening together, of you know, playing board games together and crossword puzzles. In our gift shop at the hospital, we've been having crossword puzzles, or not, I'm sorry, different puzzles in the window, and they've been flying out because families are really taking jigsaw puzzles to a whole nother level. But I think advice-wise is that the sense that this is not permanent. This is not going to be everything for the future, but a temporary chapter, and we will get through this. And I think the encouragement parents and families can give to their children about teaching them that, you know, we do go through chapters of life, that life is not always easy, and that the way we learn how to navigate is a way in many ways we define ourselves in terms of our relationship with each other.
You know, as we look at some of the takeaways from this, as we talk with Reverend Joe Hart, the senior chaplain at GBMC, I think about older adults, you know, my parents, for example, how this will forever change their comfort level. I mean, what do you say to them? You have to get to a point where you are safe, feel it's safe to leave the home, to return to doing some of the things you used to do.
Sure. I think when it comes to talking to our parents, it's a little bit of a different narrative. The reality is that most of our parents have been through varying chapters in life that have had their limitations. If they're old enough, they would remember the Korean War or World War II or the Vietnam War or Iraq or Operation Desert Storm, whatever that might be, that there have been sacrifices that have been made for a greater good. And to me, I would classify that in talking to our parents to utilize and to invite them to look back on their experience and asking the question, what resources were you able to garnish to support you to get through a particular chapter in life that might be insightful at this chapter or this time in life as we all walk through this together?
Times have changed, though, you know what I mean, with technology, and there's so much out there, so much noise. You know, how do you get that? I want to mention Maria Penn. She chimed in and she's giving you kudos to you and also Chaplain Sandy Rector.
Well, that's very kind. Thank you.
Terrific job.
That's very kind. We appreciate it very much, and we're here for everybody here at GBMC for sure.
And you must be doing a good job because I'm reading that you're amazing, that you're the most comforting person to have around in a stressful situation, and that you bring things into perspective that make life more understandable. I'm not trying to embarrass you, Reverend Joe.
Well, that's very kind. I'm very humbled by that. Thank you so much.
So what is it that you think you bring to it that make things more comfortable?
Well, I think the key piece for spiritual support that we talk about is spiritual support and emotional reassurance, trying to reassure, whether it be young people or our parents' age, whatever age group it may be, that it's going to be okay long term, that we are going to get through this, that we are not alone, we are a community, however that may be defined, whether that be virtual or in person, and that in time things will return. But through Zoom, through various other WebEx, the mechanisms that we have, to your comment that things are different, absolutely. And so to strive to utilize and to become more proficient in utilizing those resources that are available to us.
So what would you say, Reverend Joe, that has helped you maintain your balance, your own personal balance? I'm sure prayer plays a lot into that, but to help.
Absolutely. I think a centered prayer life is really crucial for all of us as we maintain ourselves through this time to keep that balance. For me personally, my prayer life is of extreme importance. Virtual worship is of extreme importance. But also for me, I have taken up cycling for the first time in 20 years. There are days I'm a little sore, but over the weekend I did 2 10-mile excursions, if you will, with family and friends, which was really a lot of fun. We kept social distance, but it was great exercise, helping those endorphins kick in. And also I'm a painter. So I enjoy going to my studio and having some solitude that helps me reclaim some balance in my life. And I would encourage all those tuning in today to try to find a resource within themselves to try to maintain that balance within their daily lives.
Maria Pan says that we need spiritual and emotional support now more than ever. Would you agree with that?
I absolutely would. And I think it goes to the point of that for those who have, national studies are showing that those who perhaps have been away from their faith or have not prayed as often, that these 12 weeks, this pandemic has been an opportunity and more importantly, an invitation to return to some of those practices that they have utilized in the past and are rediscovering them. So I would encourage anyone tuning in as well to tap into the resources of your life, to tap into those things you know best or remember from your past that can be a continuing and renewing experience of prayer and reflection.
There has been some folks who looked at this whole situation that we've been through. Obviously, you have to take into consideration all the death and loss, the families have gone through, but that we needed an opportunity to sit back, to slow down, to spend some of this quality time with family and friends, albeit forced,
Absolutely. Yes.
Because life is getting kind of crazy.
It is that. And I think this is, in a sense, a pause button on so many of the things that we just continue, if you will, in the pace of life that we keep. I think if we were to consider the life and the pace of our great-grandparents or great-great-grandparents and compared to what we are doing today, in many ways we're like hamsters on a spinning wheel, that it just never stops. And this pandemic has given us no choice other than to stop, but more importantly, to reflect. And to reflect on what is most important. What do we value most? What is it that we truly are willing to put effort into? What do we love? Who do we love? And how can we express that love for and with them in times when otherwise we may not have communicated with them?
Now, do you worry once we, there's been a lot of talk, and you've seen some of the visuals, especially over the holiday weekend, people back at the beaches, no longer wearing masks, no longer practicing social distancing. Do you worry that we're going to forget what we've been through for these past couple of months?
I find that very troubling, actually. Now, I do have a healthcare perspective on it, and we try to live that safety every day. I try at home and in my personal distancing, etc. But and I know we keep hearing it repeated daily, have the importance of social distancing. If we don't, we could have a relapse. And that, to those who were so foolish in those beach scenes that we've seen in the media over the weekend, that there may be a terrible price to pay, and that it may be a warning to the rest of us who are informed to take the practical suggestions that we hear around us and wear face masks, keep that social distancing, and be attentive to the way in which we interact with others in public. It's so important for our personal health and that of our community.
I hear that you're a phenomenal artist and painter as well. What would you say to someone about how important it is to maybe pick up a hobby or find something, an interest to get involved in right now?
Yes, I can't say that enough. Again, it's a space to discover something new within your life. I've been painting like crazy because I have the time. And if you're somebody who has wanted to try a craft, or you want to take something up, needlepoint, knitting, woodworking. One of my best friends just retired and has a wood shop in his basement, and spending time making furniture. Again, it's a wonderful place of solitude, but also utilizing your hands in different ways in which we can express ourselves that otherwise we're not used to doing. And I think there can be something of personal satisfaction because we can also look at an object that we've created. Whether I have a cousin who loves to sew and knit and make sweaters, that you can actually look at a sweater that she made for her granddaughter, or a painting that I can gift to someone or sell, or to someone who is building something, a piece of furniture for someone they know or love. There's really an emotional connection to it. It's just not an object, but there's really blood, sweat, and tears of a person and a craft and a desire that they've utilized, that the outcome is something more than just an object.
When we go through a difficult time like this, and you think back to 9/11, it seems like you always see the best in people.
Yes.
The folks who've come out to support our healthcare workers, the people who have started making masks, the people who are delivering food to the elderly and the children who are missing out on their school lunches. Why is it so unfortunate that it takes something horrible to happen for us to see sometimes the best in mankind?
Well, that is a pondering question indeed. I think that we have seen the best of humanity, and unfortunately, some cases the worst. But I'm a believer that the good of the human spirit always rises like cream for our understanding and for the betterment of people. I think when we think of how many people today are so isolated, that do not participate as parts of community, or unfortunately, from my perspective, the reduction in faith communities and the numbers of people participating. It's one thing to worship God, it's another thing to stay connected emotionally and spiritually to people in times of need. I think of the example of my grandfather, born and raised in Baltimore, 13 brothers and sisters, 9 of whom lived, he always told me, but they all married Baltimoreans. And so there were 9 families that came out of my great-grandparents. Why was that important? Because when things got tough or somebody got sick, I'll take care of the kids. I'll bring the food. I'll, cut the lawn, whatever. Today, when the average American family is 1.2 children and live 150 miles from their place of origin, it changes the whole dynamic of how community is defined. And I think in any way that we can create and make community, hopefully through our faith communities, but those who choose not to participate, that they would find a way. I think of the way that I and my family celebrated the Memorial Day weekend. We have new neighbors who are from Nepal, and they're a deck away. And so I said to them, hey, why don't we do a virtual cookout? Mm-hmm. So they had their grill, we had our grill. I did the hamburgers with tomato and mozzarella cheese in the middle, and they did Nepal chicken with different spices, and then we just handed platters back and forth across the deck. I mean, we had so much fun. We brought a piano out, they had a guitar, we sang songs, and we had a great time. Otherwise, I'm not sure if it weren't for this chapter, we would have been able or thought of something doing that together. So those are creative ways in which to create community in ways that otherwise may not be possible.
What about journaling? Would you recommend people journal?
Oh, absolutely. I think writing and journaling is so important. I've journaled for many years, and it's really a wonderful way just to have and take time to share some of the honest feelings. I will be honest that I've had dips in my road where emotionally I've come into work some days and it's just like I'm not quite up to my game.
Mm-hmm.
But I realize that is just their moments, but it's important to be honest with that. I went back and I journaled that. But then when I feel very good about things like I do today,
Mm-hmm.
I'm positive and hopeful, I also journal that. And I think that by journaling, we can go back and look at that, and a spiritual journal as well. I mean, I have a spiritual director I meet with once a month, and I do a spiritual journal around prayer and intentions and the needs of others. So to integrate and incorporate that is, I think, a very rich experience.
You talk about the highs and lows, and that is something that is probably magnified by this situation even more. I talked to my mom earlier in the week, and she was at a high. They're all the way in Arizona, so I'm one of those families that's separated from family.
Right.
But then you talk to her 2 or 3 days later, and it's a low. We can't go anywhere. We can't do anything. I mean, what do you do? What do you say to encourage somebody like that when you're halfway across the country?
Well, I think it's important that we would say to anyone feeling those examples that you share is to be honest with yourself. I think it's honest that we lean into our emotions, that we lean in and be honest. And because we are keeping so much time in isolation, that if we're there whether with parents across the country or with our family who we are at home with, is that sometimes we need a timeout, need a break. Or I think too, to be an encouragement for each other is to say, if we can be honest with ourselves in the way that we feel, then we can also share that honesty to say, you know what, if you're not doing well today, I want to hear that as well. I'm not here to be a fair time friend or family member. Let me know what you're really going through, and I'm interested. And because I care enough, even if it's time when you feel down, I want to hold that and receive that and try to support you in that.
Well, and also remind you that you have so many things that you need to be blessed for, that you are blessed with at this time, that you still have your health.
Absolutely.
I was going to say working, but they're retired. So, but
yeah. And so it comes back to that term that says accentuate the positive as well. And I think looking at the blessings that God has given to all of us and to try to find the blessings within the moments when we struggle most is also, I think, a piece of gold nugget. There was a Christian saint. Her name was Teresa of Avila. And one of the things that Teresa wrote about was that how a diamond gets its glimmer. Do you know how a diamond gets its glimmer?
No.
A diamond gets its glimmer through its flaws in the stone.
Oh, wow.
That's what sparkles. And so to me, I think that's a wonderful life example of finding, even in a flaw of our life, that some of the greatest light can shine to make the brightest diamond.
That's a very, very good perspective. And you could take that and apply that to how we've, what do they say, take lemons and turn them into lemonade. How we have celebrated. Perfect example. I was going to bring up the class of 2020.
Yes.
The graduates, this is what they will remember.
Absolutely. And I also think of taking an opportunity. One of my friends, their son graduated from University of Michigan, and they had a parade of pictures on cars and vehicles and tooting. And he was in the driveway, and they had all kinds of balloons, etc. Day before yesterday, a dear friend turned 90, and her children put all these signs in the yard, and they had a social distancing lunch with social distance portions. On the 30th, my mother's first cousin is turning 100.
Wow.
So shout out to my cousin Ella, and we're going to do a parade as well and celebrate her with music and tooting of the horns while keeping her and all of us safe as well. So these are other ways in which creativity has really paid off and makes things memorable, even with models that we didn't anticipate through the hearing pomp and circumstance for graduation or personal singing happy birthday.
And I think hopefully these are things that will carry on. I have a niece who's graduating as well, and I think grandparents and the aunts and uncles are more disappointed or hurt about her not walking across the stage than she is at this point.
Yeah.
Yeah. Tradition type thing.
it is a great moment. And I think, again, creating those great moments, I saw a picture, a film, one family who literally built their own little stage, and on the lawn had social distance chairs, and they recorded Pomp and Circumstance. She had her cap and gown, and they had a mock diploma in a roll with a ribbon, and her father gave a commencement speech of sorts, and then everyone stood and they cheered her as he gave her a diploma in their driveway. So,
Thank you so much, Doug, for checking and listening to what we're saying. People are getting a lot out of, I guess, the hope and inspiration that you are bringing us today.
Well, that's very kind. Thank you.
If you had a take home, any information that you want to give people to know that we'll eventually one day get out of this, get beyond this, return to some sense of normal, what would it be, Reverend Joe?
I think it would be to appreciate the gifts we all possess, spiritual, emotional, and the various gifts that we possess in our giving to one another, number one. Number two is to see things in terms of they will get better, and to utilize the talents and the treasures that we have to make our present situations better, however that may be. The next would be to look at the resources around us, to appreciate more deeply the smile of a child, the wisdom of an older person, to spending time and asking questions about history and our families, to learn more about those things of how did we come to be, asking older people about their experiences from the past so that young people can learn more. A lot of young people today really don't care about the past, but there's so much to be learned, and there's wisdom there. And so to draw on the wisdom, and to, as Mother Jones once said in a quote, to pray for the dead, but to work like hell for the living. That we invest in our neighbors, we invest and be attentive to change and redirect our personal lenses to prayer and to the reality that those around us who may need help or may need support.
Very, very inspirational. Tina Wagner wanted you to know that you're an amazing chaplain and friend, and again, that you're a great artist too. I'm gonna have to see some of this artwork because you're.
Well, I have a website, joehartart.com.
Okay, all right. Well,
I guess I can say that. I don't know.
Get that on the web, I guess.
Something like that. Sure. At any rate.
I hope we take away from this also, Reverend Joe, a greater appreciation of our essential workers. Our healthcare workers, as well as the people in the grocery stores. The people who in the warehouses, jobs that had to work during this difficult time. To know that, hey, a lot of these jobs don't pay a lot of money, but I hope people appreciate their commitment as well.
And I think that's probably one of the greatest gifts, is to recognize the commitment of so many within our organization here at GBMC, frontline workers of every form, and the commitment they have to being here on a daily basis, making all of our lives better and safe for our patients, our families, and our greater community. Thank you all.
Reverend Joe Hart, thank you. I appreciate your words of wisdom. So much appreciation to you and the staff at GBMC working to keep us safe, those on the front lines, those not on the front lines. And we'll keep you in our prayers. You keep us in your prayers.
Absolutely. Prayers continue. Kelly, many thanks for your commitment to our community and all the great work that you do. And together, may we make our community better and better each day. Thank you.
All right. Thanks a lot, Reverend Joe.
All the best.
You too.
Bye-bye.
Bye-bye.